Topping the news this evening, as reported cases of COVID-19 near the Bahamas, Ministry of Health officials are now amping up their efforts, now eyeing its spread in the Caribbean region. Antoinette Smith has tonight's top story.
As of CARPHA update on the 7th of March, there were a total of 9 confirmed cases across 3 Caribbean countries.
Putting the novel coronavirus a few miles closer to Bahamian shores, Dominican Republic, St. Bart's, and French Guiana have been named by the Ministry of Health officials as the neighboring regional nations facing cases of COVID-19. And as the new infections continue to close in, Ministry of Health officials say the risk for COVID-19 in the Bahamas is now extremely high.
This increased risk is premised on 4 key observations. 1. Recent reports of confirmed COVID-19 cases in at least 3 countries in the non-English speaking Caribbean countries. Sustained transmission of the disease in countries with direct flights to the Caribbean region.
Cruise ships, in addition to flights, have been a source of concern for all agencies monitoring the novel respiratory disease, putting to rest a rumor circulating on social media which alluded to 2 cruise ships, the Disney Magic and Carnival Sunshine, being allowed to enter local port with passengers infected by COVID-19. Health officials say that's simply not true, adding that contingency plans have long been in place for cruise ships.
Under the international health regulations, they are required to produce a maritime declaration of health, which is reviewed by us, and then we take a decision with respect to whether or not public health measures need to be applied prior to them coming in.
Government agencies have ramped up security and health screenings at ports around the country. And as it stands, there are still only 4 nations on the list of border-restricted countries. When asked if there was a possibility we could see more nations added to the list, Minister of Health, the Honorable Dr. Dwayne Sands, says that security measure could soon prove counterproductive.
As we get to a point where more and more countries have widespread community transmission, the benefit of additional border control interventions is reduced dramatically. And so as time goes on, it is less likely that we're going to increase the number of countries on that list.
And as cases are expected to continually rise, health officials say the focus is now on preparation, containment, and management. Antoinette Smith, ZNS Network News.